Wonderful. Again, thank you everyone for joining us today. We're excited to talk a little more with you about the value of earning your nationally accredited certification. Now, before we dive into that, I do want to ask a little bit of a poll here. Let's see. See if I can find that. There we go. I'm just curious to discover, those of you who are here, what are the certifications that you are preparing for? And you can select more than one, so please go ahead and do that. Or if it's only one, that's okay. I'm just curious to see kind of who's with us and what you're preparing for today. Give you just a second to fill that out. We got about half of you. It's always fun to see this data in real time. And it looks like so far we have almost every certification represented. Phlebotomy seems to be in the lead. So if anybody else wants to say that they're sitting for something, now's your chance. All right, I'm going to close that one down. So we have a lot of phlebotomy, medical assisting, even EKG. This is wonderful. Thank you so much, guys, for filling that out for us. Okay, so we're going to talk through some key things today about certification, but the focus is on what employers wish you knew about getting a certification, what they need for that to mean to you as a potential employee, and just some general industry statistics around certification, as well as some best practices for preparing. So to begin with, we want to let you know that here at NHA, we are fully invested in the success for all of our candidates. And we're here to help ensure that no matter what your background or needs, that you feel confident and empowered to know your resources. And no matter where you are in your journey to eventually earn your NHA certification and helping you to know what is expected of you by your next employer is an important step in this process. That's really our focus of today. To help with that, we're going to talk about the certifications that we offer. There are 8 nationally accredited certifications, and they fall in 2 primary categories. Here we're highlighting those that are more on that practitioner hands-on side of allied health. This includes medical assistant, phlebotomy, you're representing today, pharm tech, EKG, and patient care technician. Now, we also do have 3 certifications that are more on an administrative side. So this includes our billing and coding, medical administrative assistant, and e-health records, which is a really great and easy certification to stack along with the rest of them here. Now, beyond this, NHA does create learning resources to help support all of these different professions. They range from skills developers, soft skills, even clinical skills. But we're really going to focus today on those 8 nationally accredited certifications, specifically what employers expect. So let's jump in. The first insider's tip is to really understand what it is that you're doing with certification, what it is, what it isn't, and how they're not all created equal. So having a certification represents more than just completing a course or a program. It actually shows you've gone further. You've had your abilities, your skills and knowledge proven through an outside source. You're evaluated at a national level when you take a certification exam, and that can show that you've met certain requirements to have a mastery of the skills or knowledge in that chosen field. Now, this is different than earning a certificate of completion, right? These aren't the same thing. A certificate of completion shows you have finished something, usually training through a program. Earning a high school diploma, for example, is earning a certificate of completion. It shows that you finished something. A certification is obtained usually through a national certification agency by taking and passing a credentialed exam. So think about the difference of going to medical school and becoming a doctor or a nurse. You first have to finish the school, and then you study for and take an exam to actually earn that license. So that's that difference between a certificate of completion and a certification. So when you look to get your national certification, it's always important to take note if it's an accredited one. But okay, what does that really even mean? Well, having an accredited certification, like those that NHA provides, means that you're being tested on something that's been evaluated by the industry at an industry level, not just what we think you should know, right? But what the industry says you need to know. Now, not all certifications are accredited. So making sure yours is can really make a big difference for an employer. So these are the accrediting bodies that NHA works through in order to earn our certification. NHA's resources are also recognized by program accreditations. So we're also a sponsoring organization of one of these programs. So basically all this means to say is that you can feel very confident in your decision to work with NHA and become certified, right? So looking to see your face here very, very soon. A quick search on any organization's website, like NHA's, should bring up the ability to see their accreditation status. Always do your research beforehand to make sure that the certification you're earning really stands for something in the industry. Some other information to know is that NHA is the largest entry-level healthcare worker certification organization in the industry. We actually are closing up on 15, we almost have 1,500 certification holders, candidates, as you want to call it. We're leading the industry in the resources we can provide to help as you study due to how large we are and how many resources we have. So the next super tip on certification is understanding what employers think about it. Specifically, why is it important? So why do employers want you to get certified? NHA works with employers across the country, and we know that they value candidates who have an industry certification. And we see this in that those who do are more likely to get hired, often have a higher pay scale, better job security, even pathways for career advancement. Having your certification also tells employers that your skills are credible. It shows that you have a set of abilities that have been proven and will provide that employer with improved standards of safety and care, which is often what they are evaluated by. So it's a really important thing for them, for you to have that certification. Even though a job posting may say that they're looking for a medical assistant or pharmacy technician, when employers go into screen applications, having that certification will make you stand out. 83% in a recent survey of employers across the country reported that they would hire a candidate who was certified over one who doesn't. It's a really large percentage. We have a lot of great data. We know employers don't only prefer you to be certified, but most require it. This is information on several of our certifications. They're expecting you to be certified. You can see the reported percentages of what they do expect from you or require from you for that. Here's also some information about what hiring managers have shared are the most important pieces when they screen applications. You can see that if you are applying for a job, even if the job posting doesn't say they require certification, they're looking to see if you have one, possibly even to make that review. To simplify all those numbers, basically, on average, most healthcare employers either highly encourage or require that their staff earn or have an industry certification. And most HR teams use if you have one in a screening process prior to hire. We know because employers across the country feel that having a certification in your field means you are better prepared for the job. So that's what employers want, right? So now what they think about the certification, let's talk about what they need you to be as a potential employee with a certification. A few other items from our recent survey showed that some of the most important skills a candidate needed to show beyond certification were soft skills like professionalism, critical thinking, dependability, and verbal communication. So these are labeled as soft skills, right? Not the technical side of the job. But of these specifically, it was identified that critical thinking and dependability were most often missing in potential candidates. When employers talk with us here at NHA and we say, what are they looking for in a candidate? They say soft skills, and are they certified? Now, NHA does have additional resources around developing these essential soft skills you can look into. Your program may already be offering it if you're enrolled in one, but we can talk about that. We also know that computer skills are becoming more and more important. Even in just a few short years, an increase of telehealth went from 11% of visits to 46. We know that this isn't going away anytime soon either. Your ability to keep your professionalism and communication with virtual discussions is a huge benefit to an employer and can help enhance the patient experience, which again is something that those employers are usually assessed on. We have seen some other industry trends on hiring and candidate skills, and we know that on average, employers are having a really hard time locating qualified candidates. And we know that's where you come in, right? It's why having your certification can really make the difference based on what we've discussed so far. There's also an increase in employers stating that their employees have more responsibilities, and on average, candidates lack required EHR skills. This is true for all roles, but specifically large for those where they have a lot of activity with a patient. So that's where maybe that stackable certification with our eHealth records credential could go a really long way. So it's not just that having a certification will help you get your foot in the door, right? We know that, but it will also shows that the employers will increase pay when a candidate earns a professional certification. We know that also having just one certification is great, but those who earned a second credential had on average even higher increase in earnings. Now, this trend for employers to pay more when you're certified is something that has been increasing slowly over the last several years, and we don't see this going down anytime soon. So presently, 74% of employers responded that they would increase your pay if or when you're certified. We know that starting is often the hardest part, so congratulations on doing that. An increase in pay is a great place to begin, so getting that first certification is a major step in your long-term success. But what does the data say for those who do look to maybe stack credentials even further? Well, recent research shows that healthcare is one of the most popular areas where stacked certifications are found. So that's those who choose to build on their skills, not just continue in the same basic area, but they cross-train, have a higher benefit. So for example, earning both your medical assistant and phlebotomy certifications have shown to have a higher benefit for income, as well as probability to get the job. Not just the job you can get, but the job you want. And though those who earn a certification see a higher probability of an increase in pay, again, those who stack often see an average from 11% to even 46% further increase with a secondary certification. We also saw that those who do are actually more likely to go on to further education, with 71% of those earning an associate's degree and 9% getting a bachelor's degree within 4 years after completing their first certification. So this first one is just your first step on a great road on a wonderful career in healthcare. Okay, so the industry is growing. You've picked a great field, and you know that getting certified will help you move forward. Awesome. But now what? How do you know what to do to move forward? That's a big question, and that's where NHA can step in to help. Depending on your academic program or employer, you may be able to have the NHA study materials for your exam provided to you. You may already have them, but using these will be the best way to get you ready for exam day. Now, I've been talking for a minute, so I'm going to actually launch another quick poll here. Let's see. I'm going to find this. There it is. Boom. This is a simple one, only 2 questions. Have you already created your NHA login? Yes or no? And if you're not sure, that's okay too. But we're just kind of see who's with us today. All right. We've got about half of you. Anybody else? Overwhelmingly, it looks like the I haves, yes, is in the lead, which is totally fine. We've got almost everybody. So yes, it looks like 92% of you here with us have already created your login. Now, if you haven't, that's okay. We're going to talk a little bit about that here real quick. So let's go in and just look over some best practices for this. So when you go to set up your NHA account, which again, if you haven't, now's a great time. There are a couple things to keep in mind. The first is that before you do, so for those of you who have not yet, check in with your institution. They may have a special process or a way for you to do this, and you just going on and creating your login now may disturb that process. So first and foremost, if you're going through an institution like an employer or a school, check with them before you begin. But once you do, we recommend that your NHA login email be a long-term email address, one that you'll check frequently, not just while you're getting your certification. Also, make sure you recognize and remember what your password is. We know password requirements can be really specific, but we don't want you stuck in a testing center, ready to take your exam, but not able to because you forgot your password. The other piece to make sure of is that the name on your account is your legal first and last name, whatever is on your government issued photo ID. So even for those of you who have already done this, if it's not this way, contact the NHA customer service team. They can help you update that. But this name and your ID is what they'll use on exam day to verify you. If your account name doesn't match, you may not be able to test. So definitely make sure that we check that and that that's correct. So using the NHA materials, which are based on our exam test plans, is a great way to help you prepare. So the full prep package includes an online study guide and a series of practice tests. You'll get personalized reporting tools and a secret unique tool called the Focused Review. We're going to just talk a little bit about these real quick. So the online study guide has a lot of amazing features. We're going to just talk through some of them. Each exam package is unique, so they might look a little bit different, but all of them have a similar format. So it's always going to be broken into categories or sections, each one aligned a core content area from the exam. These chapters will take you through how NHA will talk to this material and test you on it. You will have access to activities and games. There are checkpoints and assessment tools. Use these to apply what you're learning and see how well you're retaining the information. Don't take a quiz over and over again just to get a good score. That's not what it's there for. There are additional features like glossaries of key terms, flashcards, even a series of professionalism videos. Now, these won't technically be content on the exam, but they can help you with some of those soft skills we were talking about to prepare for interviews or even job placement. For those of you, this is another view of one of our resources, so it doesn't look exactly the same again, but all the same tools are there. Your menu is up at the top. You just open that icon, and that's where you access all those same features, glossary terms, videos, and kind of seeing all the different checkpoints. Now, in addition, NHA has a flashcard-focused app that you can download. Once you have access to your study materials through our website, you can then use your same login to download this app. All flashcards you have access to within your learning resource will be available with fun ways to keep organized and help as you review. This is downloadable for you, again, by through Android or Apple. And we do have how-tos on the website that will walk you through how to do that, just depending on which device that you're using. So our study guide. But let's talk about those practice tests. You have 6 different practice test attempts, and they are designed to look and feel as close to the exam as we can create. They are scored differently than the NHA exam, which we'll talk a little bit about. But though you have 6 different attempts and a lot of versions, doesn't mean that you should take them all right away to memorize questions. These are designed to help you prepare and study for your exam. Each of these attempts covers the full certification exam content, but don't expect that these exact questions will be on the exam. It covers it in a similar way. So memorizing these is not going to help you pass the test. That's where the reporting is helpful because they'll follow that test plan outline for all scored questions, but then you'll get feedback and reporting, as well as additional tools to help you study. Your practice tests do not give you an A, B, or C style grade. They do give you scores of accuracy, but these scores are not the same as what you'll see for your actual certification exam. So use this to see kind of where you're still working. What haven't you mastered yet, rather than defining where you are as far as a passing score. It's possible that your program may turn on or off instant rationales on these questions to help you prepare. We do suggest that you try for at least one, if not two, practice tests to be as close to a real exam feel as you can create, even timing yourself. Some of our materials would do this for you. So if you see an exam labeled as a baseline or a final, not all packages have that, but if you see anything labeled as baseline or final, those will be timed and all rationales will be turned off. So you can use that for that real exam experience. Now, again, though you get a total of 6 attempts, we really see that those who use at least the first 4 have a higher possibility of passing the exam in their first attempt. So I mentioned earlier, you also get the focused review. This is another part of your prep package. This is tied to each practice test attempt and is designed to help you focus on those areas, again, that you're still working through. It helps to ensure that you take some time studying before your next attempt. This resource can be filtered. It can also be printed. You can go back and highlight areas or make flashcards out of it. Spend time in the competencies that you still need to work on. Now, it's not interactive like the study guide, but it can make that difference in helping you get through those practice tests and improving your score from one to the next, which is really the ultimate goal of those. All of these tools have detailed reporting for you to see what you've done, where you've spent your time, how well you're doing across the materials. Now, we do have other webinars where we talk more specifically on reporting, as well as best practices for using this material. They're available in our on-demand center. So if you do want to access that or look for some coming up, we hold webinars like this all the time. Go to our website. Under the resources dropdown, you'll see webinars and events. And this is where you can look at either on demand, so ones that have already occurred, or register for more coming up. All right, so one of the other questions we get a lot is, how do I know I'm eligible to take one of these exams? And we have, of course, resources to help. So right from your home screen of your candidate account, once you've created it, you have an option to find out if you're eligible to test. Scrolling down on the page this takes you to will take you to a short quiz, as well as a link to the candidate handbook. That gives you all of the information. But the short quiz just asks you a couple of questions to clarify, am I eligible? Well, in most cases, if you're testing through an academic program, a school of some kind, you should have all you need to meet the minimum requirements for NHA's exam. Do confirm with your institution, especially for you phlebotomy or EKG candidates. There are some specific things you need to make sure that you've met. So that's something you would want to talk with your program about. But ultimately, there is more than one option for eligibility. Again, you can complete an academic program. This needs to be done within the last 5 years. This also includes employer training programs or active military training. Or if you're doing this independently, if you've worked at least 1 full year of consistent work in the role within the last 3 years, you're eligible to test. We want you to study a little bit, of course, but you're eligible. So no matter how you're studying and preparing, you know now that there are resources available to you. But what's the best way to use those resources? So let's kind of outline our timeline here. Start by creating that login. The sooner the better, right? But also double check with your institution so we don't accidentally go a little bit too far too fast. If you can, or if your program is providing it, get access to those study materials as soon as possible. A recent survey of over 6,000 certification holders confirmed they wished they had had those materials sooner so they could study better prior to testing. On that, following good study habits is an important part of this process. With the NHA materials, we do recommend that you go through the study guide first, using it to help you see how NHA is going to talk to these materials, what we're going to test you on. And then when the time is right, start taking those practice tests. Again, these follow the full test plan, so using them too soon may not help, but use them to see how you would do on the exam itself. Don't just take them to memorize questions. We want to see these scores improve from one to the next. And that is where the focused review comes in. Use it and any additional materials you have through a program or employer. Study in between each of those practice tests. Now for exam day, be sure to apply for that exam as early as you can. Best is at least 2 weeks beforehand, if not earlier. If you have an accommodation request that needs to be submitted, this needs to be at least 4 weeks before your exam. You have to apply at least 7 days in advance to make sure everything is ready for exam day. So get that done as soon as possible. Now, as we get closer to the test, I would say around the day before or so, be sure to check your email and password. Remember, we don't want to get stuck in a testing center if you don't remember your password. So do double check that beforehand. Now, on exam day, show up early, right? Plan ahead for traffic and parking. Actually, walking into the building takes time. You can finally then feel confident that you're ready to go, take that exam, and earn that industry certification. All right, I'm going to ask another quick poll here. Let me just open that up. Let's see. There it is. So we just talked quite a bit about the NHA study materials, and I'm curious if you have access to these. Yes, I have them. I'm getting them. I'm not sure. I intend to buy them on my own. Take a look at these different options. We're just curious how many of you do or are looking to obtain your certification. Give you guys a few minutes to look that over. And hey, if it's other, please post that in the chat. Let us know. I'm curious. All right. Got about half of you. Anybody else? Looks like in the lead is that, yes, I have purchased or been provided my materials, but we have folks in just about every other category. So I want to thank you guys so much for doing that. Hopefully what we learned today was a little bit helpful to using those materials. So the next tip for you here on your career path is what happens after, right? I've gotten my certification. Great. What's next, right? Just having that is the first step. But we want to make sure that employers know, and there are more options available. So let's take a look at what those are. Once you pass that exam, I've talked quite a bit today about stacking. Keep going. There are always options to further your career path and add additional industry credentials. I mentioned, for example, e-health records, stacking phlebotomy and medical assisting. There's all kinds of ways that you can stack this. Now, also know NHA has a job board on our website where employers across the country post jobs looking for certified candidates. We also we have a blog space where we are constantly loading new articles about interviews, job searching, industry data, resume writing. We even have podcasts you can listen to. Now, beyond that, it's important to remember that your certifications don't last forever. You do need to keep them updated by completing continuing education credits. You can do this typically through our portal or through uploading completed coursework. But just know you will be notified by NHA once you've earned your certification on the options for you to be able to maintain that certification. And I talked about those skills developers earlier. Purchasing and completing some of these can actually also count as credits towards your renewals. So again, they include some of those soft skills developers that we know are so important for employers to see in you as a candidate. We highly recommend, if you don't already have one, that you have a professional online presence. So whether that be a LinkedIn profile or something, to be sure that you add those credentials to that. Employers will Google you, so make sure that they see that you have your certification. You can also put the certification initials right in your email signature. Absolutely include it in your resume, your cover letter. Make it clear that you are certified, and use every resource at your disposal. For example, if you're doing this through an academic program, I'm sure there's a career services team or someone to help you identify what your best next steps are. Don't forget to bookmark or favorite our website so you can access all of these resources. And then finally, also let us know. Go online, post the hashtag NHA certified. We love hearing your stories. We're here with you on this road, and we really, really do love hearing from you. Some other cool things to note, a great benefit of partnering with NHA is that we've had a program called the American Council on Education, or ACE, has approved for some of our certifications to actually provide transferable college credits through a program called Accredited. So if you're sitting for any of these certifications, you will get notifications on that. So if you do look to further your education, you have already some college credits in your back pocket. Again, to help with all of this, as an NHA candidate, you will be getting email reminders and resources directly from us over specific times through your journey. They'll cover a variety of different things that might include how-tos, resources, other webinars like this, blog articles. So do take a look, look at those emails. They are carefully crafted to provide you information that we know you probably need. Here is an example of just one of our candidate testimonials. We really do love hearing from you, and we know that this is hard. Working in healthcare is hard, but it's also incredibly rewarding. And so just from all of us here at NHA, I want to let you know how proud of you we all are for even taking this first step. Please know that you'll be changing lives, not just the patients you'll work with, but the lives of those around you. They can see how hard this is and the dedication that you're putting into this, and I promise it will make a difference. So again, I'm so excited to hear yours. We have a lot of inspiring testimonials on our YouTube channel. I can't wait to see you there, so hopefully you'll be there soon. I am going to ask one more quick question here. Let's just go back. There we go. As we develop more of these style webinars, what would you like to learn about, right? What are the things that you would be like, you know what, I really want to know more about? These are just some suggestions. If there's other, post it in the chat. Take a quick minute and read through all of these and let us know kind of what would you like to see more from NHA in the future? I know there's a lot, so I'll give you guys a second to read through them all. That's okay. Excellent. See some responses coming in now. So pretty much everything is being addressed. This is exciting. This will help us to develop more. Also, the survey that we're about to post in the chat will also give us some great feedback. So please, please fill that out. Thank you, Lauren. We are looking for that. So do remember that anyone who fills out that survey will be put into a raffle to win a $50 gift card. So please, please fill that out. So as a reminder, we have been recording today's session. We will be sending that recording out to everyone who registered, and we are going to go ahead and move into some Q&A. So I would love to hear from the team. What's going on out there? What questions do we have so far?
Laura, it's been very quiet. We have no questions that are listed as of now,
What?
unless someone wants to drop one in the Q&A box or the chat box.
No, you've been paying attention, you guys. That's exciting. I appreciate you guys really focusing in and paying attention here, but let's open up. I'm going to actually go ahead and stop the recording now, but we will stay on for another 10 or 15 minutes and we'll just answer questions as they come. So again, I want to say thank you to everyone who's been with us today. We know that this is hard, and I'm excited to see where you go next. So again, thank you all so much.